G'day, Ancient Mahara here on the subject of quiet borderline personality. What is a quiet borderline? Is that a separate thing from borderline personality disorder? No, it's not. So there are four subtypes of BPD. So the quiet borderline, which is the discouraged borderline subtype. And discouraged borderlines are often also thought of as dependent. They are often clingy and passive and very reliant on others. They tend to turn feelings of anger, any feelings really, but anger especially, inward, and they're very prone to episodes of self-mutilation, self-harm, suicidal behavior. They have feelings of emptiness and an intolerance of being alone that, while most people with BPD, if they're untreated, have some pretty high degree of intolerance of being alone, this is indicative of BPD, and it's exacerbated in a discouraged or quiet borderline. This, fear or intolerance of being alone, and this experiencing emptiness. And I would add to that very low, no self-worth, no self-esteem, and very much don't feel worthy. So Theodore Millian was a noted psychologist and author, and he published a book defining four distinct subtypes: the impulsive borderline, the petulant, the self-destructive, and, as I'm going to focus on in this podcast video, the discouraged borderline, otherwise known as the quiet borderline. And BPD is often comorbid with other disorders as well as overlapping symptoms, making it hard to diagnose at times. But there may even be other subtypes of BPD: affective, empty, aggressive, and dependent, to name a few. More is being understood about BPD daily, and more research is being done. The terms will likely evolve further. Theodore Millian's types have stood the test of time so far. However, I'm going to have a lot more coming because there are a lot more studies, and there's a lot more out there now that is aiming toward what will be likely a whole different way to look at BPD. So what I want to say here with starting out with the quiet borderline is the subtype of quiet BPD, the discouraged borderline, is that there is more and more growing evidence through studies, and as recent as this year, that CPTSD and BPD may not be exactly the same, but they may overlap to the point where they can't be separated either. So I'll have more coming on that. What's up with the quiet borderline that so many people are so confused by and feel like extra hurt by? And I've had clients express to me that, well, if only they were acting out and they would yell and scream and rage at me, I would have left a long time ago. But people don't seem to understand, or sometimes don't quickly identify, that they might be with somebody with a subtype of quiet BPD, discouraged BPD. So quiet BPD is difficult for professionals to diagnose and treat, but the earlier somebody who has quiet BPD or thinks they might have BPD, but they're not sure if it's, if they've heard of quiet BPD or not, the better the outcome is likely to be. So what is quiet BPD? Well, like I said, it's a subtype known as discouraged borderline. And the term quiet BPD can be misleading, because having quiet BPD means that you direct any mood swings, behaviors, feelings, anger, impulsivity, etc., it's directed inward rather than directing those feelings, etc., out toward others. So people with quiet BPD act in, they don't act out. Now, that doesn't mean 100% and for always, but the majority of times, some people with quiet BPD will not ever act out. Some will act out sometimes, and sometimes when they're getting to that point of the final devalue split, they may well act out. So, but predominantly they don't. Acting inward can complicate an already invisible mental illness. With quiet BPD, you may direct significant feelings toward yourself without letting others see them. And some of these intense emotions that people with quiet BPD are grappling with and unable to soothe and unable to really cope with, anger, anxiety, fear of abandonment or rejection, emotional attachments, obsessions, mood swings, self-blame and guilt, severe self-doubt, and rage. So quiet BPD is also sometimes called high-functioning BPD. Prior to maybe the last, 10 years or so, high-functioning denoted someone that didn't act out so much, so that would be the discouraged quiet type of BPD. But also, there's a little bit more elaborate infantile defense mechanisms because it gets internalized instead of externalized. However, that's very risky, more risky for people with quiet BPD than it is risky for those who have acting out BPD, whichever of the other subtypes. So it's another potentially misleading term, quiet BPD, high functioning BPD, that indicates a person with this type of BPD just doesn't show their symptoms and are still able to cope in everyday situations like work and school. But they might not be coping so well in relationships. But again, you're just going to get that silence and withdrawal. They will withdraw and be silent when they're not coping well. It's about the only sign that there really is. So what are the symptoms of quiet BPD? Well, it manifests inward for the majority of time for the majority of people with quiet BPD. In this form, the discouraged type of borderline personality may be difficult to identify at first, right? So notable symptoms of quiet BPD include mood swings that can last for as little as a few hours or up to a few days, but no one else is aware of them except the person internalizing them. Suppressing feelings of anger or denying that one feels angry. Withdrawing when they are upset. Avoiding talking to others who they feel upset by, and often they just cut themselves off instead and withdraw into what people experience as the silent treatment. They blame themselves whenever there's a conflict. They have persistent feelings of guilt and shame. They have extremely poor self-esteem, if they have any self-esteem at all, really. They have a very thin skin and take everything personally. They feel like they're a burden to others. They have a lot of feelings of numbness or emptiness, and I've worked with a lot of clients with quiet BPD that really aren't in touch with their feelings, which can be true of the acting out as well, but it's very predominant with all this internalizing by the quiet borderline of all these feelings. It's often they feel empty and this numbness because there's a lot of emotion there, but they are just protecting themselves from it. People with quiet BPD often feel detached from the world and sometimes feeling like they're in some kind of a dream or surreal, life is surreal. It's sort of like derealization, which is a form of dissociation. So the quiet borderline is going to be a little more people pleasing, and that might even be, they do that at a cost to themselves. I would add in that this subtype especially is very codependent. They have a deep-seated fear of rejection, a lot of social anxiety, and they self-isolate a tremendous amount. And yet they can have a fear of being alone, but even with the fear of being alone, they will still push people away. That pushing away is largely by little to no contact, silent treatment, withdrawal. If you're not living together, they may not text you or respond to your text for a week or 2 weeks or whatever. Or when they get to a final devaluation, so out of sight, out of mind kind of split, then you just may never hear from them again. Some of them may be the type that may be people to Hoover, and some of them may not be. And so the other thing that they really struggle with, another symptom, is self-harm or suicidal thoughts. So people with quiet BPD may experience just a few of these symptoms, while others might experience more, because not everybody with any subtype or type within borderline personality is exactly the same. So what are the possible side effects or complications of quiet borderline personality? Well, many people with quiet BPD struggle in silence out of fear of burdening anyone. Without help, though, the symptoms tend to worsen over time. And there's also increased risk of other comorbid things, like bipolar, depression, eating disorders, generalized anxiety, substance abuse, social anxiety. So people with quiet BPD really have a very, very difficult time trying to establish or sustain relationships. And some of the related symptoms to the discouraged type, known as a quiet borderline, also really rather even more so complicate difficulties in the area of establishing but also sustaining relationships, which they often can't sustain them if they can establish them. They can also have difficulty in maintaining a work or school schedule, so they might find it increasingly challenging to maintain their role at work or in school. Untreated quiet BPD may increase the risk for acting out impulsively and engaging in uncontrolled spending, gambling, drinking, and other dangerous behavior. But often when the quiet borderline acts out, it's not directly to the person closest to them if they have someone close to them. So what are the causes of quiet BPD? Well, there's a speculation about the heritability, right? But there's nothing proven on that front. So, there could be a family history, but that doesn't necessarily mean genetic. That can just be the intergenerational, repetitive, unhealthy parenting. And of course, it's been really noted, and more is known now even than what I'm saying right now. Like, there's even more to talk about now, that emotional and physical abuse, as well as childhood neglect, increases an individual's risk. Exposure to or a personal injury of unstable relationships may also contribute. But the thing is, so, again, goes back to that childhood trauma. And then it's been speculated that there's alterations in the neurotransmitter serotonin can be associated with BPD. But it's not clear whether brain changes lead to BPD or they occur after the fact. It's my contention in all my experience, personal and otherwise, and with clients, and also what psychiatry cannot prove right now, is I would say that the brain changes that are seen occur after the fact and are not the causative reality of BPD in the beginning, because it's too well established that has to do with environment. So I'll leave it. Well, I'll just say that they say that BPD is a sensitive temperament, and that's one thing. And if a person was even born with that, fine. But then it needs to meet with an invalidating environment in order for someone to really end up with the emotional arrested development that will be BPD, and no matter which of the four types. But, it's the same for quiet BPD. So there's other risk factors that have been shown to influence the development of quiet BPD or the discouraged BPD subtype. And these can include a history of eating disorders, substance abuse, could include if they have bipolar disorder, which, today psychiatrists trying to fuse these two things together, but I don't think they're all that similar. Anxiety, depression, abandonment, or neglect. And I would just add again, trauma and abuse. So how is quiet BPD treated? Well, it can be difficult for someone with quiet BPD to acknowledge a need to talk to someone about their struggles, and they'll likely find a sense of freedom and validation if they do. But it's really hard for them to. Psychodynamic therapy, as well as DBT, can be very effective. Some in psychiatry would say medication. I would say not really. With practice, it can help reduce self-destructive thoughts and actions, through DBT as a start, but psychodynamic therapy to do the deeper work. Medications are counterindicated in the treatment of BPD. So, and that is the subtype discouraged, quiet borderline as well. They don't address the underlying causes of BPD at all. So quiet BPD can take time to identify, but the sooner that either someone else can identify, but then you can't really tell them about it or get them to hear you. But many people with quiet BPD are now kind of recognizing themselves in the description of quiet BPD. That's been happening on a couple of videos I've done a while ago. One is how to spot the quiet borderline and what is quiet borderline personality. I've had a lot of people comment on those videos who say, wow, I think this is me. So if you feel that way, it would be really important to reach out and to seek some treatment. if you haven't already. And it's important for people with quiet BPD to recognize that their feelings really do matter, and that it is okay to share them with, like especially a therapist, but they may have trust issues why they can't just share them with somebody else. And the subtype discouraged borderline quiet BPD, it's really, really hard for them to know what they are feeling often or how to even express it, because they've been internalizing it, their feelings, etc., for so long. And so there's a struggle with persistent guilt and poor self-worth. But people with quiet BPD need to know that they're worthy people too, and they really do need treatment, and that they can benefit from treatment. And I just know in my experience of working with people with quiet BPD, it's very difficult for a time, and each person takes their own amount of time, to get them to really talk about what they're feeling or what they're experiencing, or if they're angry or if they're sad, or all these different kind of feelings. It really is difficult you feel like you're not really trying to pull information out of somebody, but it takes I found it takes a lot of questions, it takes a lot of talking about things in general, and often you'll get one-word answers. And so people with quiet BPD, other people equate it with, being like a vulnerable, somebody has discouraged BPD, which is quiet BPD, that's like a differential diagnosis or equatable with a vulnerable narcissist or a covert narcissist. And that's not really accurate. Could it be that somebody could be with any of the 4 types of borderline personality as identified by Theodore Million? Could anybody be comorbid with NPD? Well, it's thought yes, and there's different percentages thrown around, but that's not everyone. And everyone with quiet BPD isn't the same any more than anyone with BPD in general is all the same. Because it is so difficult if you are with somebody and then you start to suspect they have quiet BPD. It's really important that a professional gets involved to do this diagnosing, though, and that people aren't diagnosing from just YouTube and books or blogs or whatever. But having said that, a lot of people kind of do get the feel for what they're dealing with. And then, of course, when you feel that silent treatment and you feel like it's so punishing and manipulative, it's really not the intent of most people with quiet BPD. But it can certainly be the experience of those on the other side of people with quiet BPD. So I hope that was a bit helpful. And I'm going to have a lot more coming on BPD in general and what's happening with BPD and CPTSD, and are they differential diagnoses, or what's going on with borderline personality specifically with CPTSD, and what really is CPTSD, and what are the latest studies saying, and where is this all headed?